While we are discussing this topic or the subspeciality of geriatric psychiatry, it's again very important to focus on the anxiety disorders which are quite prevalent in this age group. So sometimes it's quite a confusing picture how to differentiate between the anxiety disorders because they have the similar symptoms sometimes to the depressive episodes which are again quite common in this age group. So when we are basically looking on to the symptomatology of the anxiety disorders, it's quite similar to the anxiety disorders of any other age group, which is basically including the sympathetic outflow, indicating the increased sympathetic outflow, which is indicated by the tremors in the hand. Then we have the palpitations and sweating is seen in these patients. And the situations that are basically arising this anxiety disorders is again very important. History taking will be very important in such scenarios. There are basically a variety of anxiety disorders which is seen ranging from the agorophobias and the social phobias which are arising these situations of anxiety in this old age group people. So separation anxiety is also seen in these individuals. It's quite common. Usually the people who are belonging to this old age group, they're living alone and they're suffering from the empty nest syndrome. Usually they are in the old age home and they're suffering from these anxiety disorders. So dealing with these anxiety disorders, one should know how to diagnose the cases, how to go about and assess the patient, what are the causative factors that are basically ranging from person to person depending upon the scenarios and the life events or the life circumstances of that particular patient whom we are dealing with that on that current situation. So in this section, basically, we'll be focusing on the epidemiology of anxiety disorders, how prevalent it is and how prevalent it is in this older age group. It's again very important. Then we'll be moving on to the symptomatology or the clinical manifestations of anxiety disorders in the old age group people. And then we'll be discussing another very important phenomena which is seen in the old age group people and is known as the substance-induced anxiety. So usually alcohol is one of the substance of misuse or the drug dependency that is seen in this age group, that is quite common in this age group, and that is basically producing that anxiety, or the withdrawal symptoms are sometimes regarded to as the anxiety disorders in this age group. So diagnosing the case and diagnosing the causative factors in that particular case is again very important. So first of all, just to give you an overview about what is anxiety, it's a normal adaptive emotion. So we do not regard anxiety as to be always an abnormal emotion. It is a normal emotion that is present in every individual. And it is basically when you run from a tiger or when you want to pass a test, those sympathetic outflow that is basically increasing your palpitation, your heart rate is increasing, you're sweating in that situation of fear and flight. That is basically regarded as due to the causative factors are obviously the sympathetic outflow, and that situation that is creating those physical symptoms. This is known as anxiety in a normal situation. So basically, anxiety is considered to be abnormal when it is excessive. So when it is excessive, it is maladaptive. The person basically cannot function at work, in school, or even the normal relationships. The peer relationships cannot be formed quite in an effective way. Basically, the person is paralyzed emotionally, and it's very embarrassing even for that situation, for that person who is suffering from anxiety disorders. So knowing these disorders and working on them, how to work out and how to basically help these patients getting treated through these anxiety disorders is again very important. Now, what is the common symptomatology that is seen in these individuals? It's basically dependent on the cognitive aspect of that individual. He's going to basically start worrying more, being more fearfulness. So fearfulness is going to be there. Extreme fear is basically defined as the worry or the extreme worry of an individual. So this is going to be the thought process of that individual when he's suffering from an anxiety disorder. And moreover, there are going to be the behavioral changes seen in these individuals. Phobias are quite commonly seen in these individuals. And then we have the hyperkinesis. Increased movement rates are basically defined as the hyperkinesis of these individuals. Physiological changes are going to be noted down, such as an increase in the heart rate or the palpitations are seen, and then the hyperventilation, which is basically recorded by the respiratory rate. If there is an increased respiratory rate, we regard it as a person who is in a state of hyperventilation. So the epidemiology, when we discuss it, it's the most common group in the mental illnesses. One of them is depression, and on the other hand, we have anxiety, as 50% of those having depression have significant anxiety also, accompanied along with depression. Then we have the ego-dystonic attitude of these individuals. Patients usually come to us and they are uncomfortable about these situations that they arise, that they are usually put into. Usually there is no factor that is causing it. There is basically no known factor that is causing that anxiety situation in these individuals. So it's quite embarrassing for these individuals, and that's why they come out for help to the clinical psychiatrist or to the practicing psychiatrist. It's the most common group of the mental illnesses. 11% of the population is suffering from these anxiety disorders, and they cause a significant amount of dysfunction even from the day-to-day work or the life at school, work, or even the interpersonal relationships are affected through these anxiety disorders. They may even lead to the disability of the individual. So the anxiety disorders that we usually see are the panic disorders. Then we have the agoraphobias, that is basically the phobias to be in the rushy areas or to be in the open spaces. So that is basically regarded to be as the agorophobic individuals. Then we have the social phobias. Specific phobias are sometimes there. Specific phobias can relate to heights, water, etc. Then we have the generalized anxiety disorders. And then we can see obsessive-compulsive disorders that can basically correlate with the anxiety disorders as well. Then we can have people with the acute stress disorders, people who have suffered immense trauma in the past or between 3 to 6 months of last time period in their lifetime. We have to basically take the history in detail just to get to know the person more. And if he's suffering from some sort of post-traumatic stress disorder, that can be analyzed after you have taken a detailed history of that individual. So even it can be the substance-induced disorders in these individuals. So when we talk about the substance-induced anxiety disorders, it's quite a common phenomena that is seen in these individuals. And it is more likely to happen with age. The drugs related are alcohol, cannabis, anticholinergics, antidepressants, anti-TB drugs, antihypertensives, caffeine, cocaine, digitalis, dopamine, amphetamines, even NSAIDs that can be taken for painkillers. They can even cause the substance-induced anxiety disorders. Sedatives and hypnotics are quite notorious. And then we have theophylline in this list as well, which is causing the anxiety disorders in these people who are basically taking multiple drugs for the treatment of different ailments. So in this section, basically, we gave you an overview of the anxiety disorders in the geriatric age group people and how do we go about and treat these people. So that is the end of this section. Thank you for watching sqadia.com.